If you've spent any time around a newborn, you know the exact sound, followed immediately by that tiny, sudden jolt. To a first-time parent, watching a baby's entire body seize up like a glitching robot is panic-inducing. We assume they're miserable. But the truth is, most infants aren't bothered by this at all, and many will sleep right through a major episode. To understand why it happens, we have to look at the mechanics. A hiccup is a sudden, involuntary spasm of a specific muscle, which forces the vocal cords to quickly snap shut, producing that tiny hic sound. This shows an infant's torso. The key muscle is the diaphragm, sitting directly above the stomach. Swallowing excess air or drinking too fast expands the stomach. It presses upward against the diaphragm, triggering a sudden contraction. Historically, parents have tried to stop these spasms with some truly terrible ideas. You'll hear old wives' tales advising you to pull the baby's tongue, or even jump out and try to scare them. You might also be tempted to offer a few sips of water, because that works for adults. Pediatricians strongly advise against this. Giving extra water to a newborn can throw off their delicate internal balance, which is incredibly dangerous. The real issue is that we treat these tiny spasms as an error that needs to be fixed. The baby's body isn't making a mistake. It is executing a specific biological task. Researchers are now looking at hiccups differently, not as a physiological mistake, but as an active, necessary trigger for early development. A team of scientists at University College London decided to monitor the brain activity of newborns specifically during these hiccup episodes to see what was actually happening under the surface. Every time the diaphragm spasms, it sends a massive sensory signal straight up into the developing brain. The moment it hits, the brain fires back. For every hic, researchers recorded 3 distinct waves of brain activity lighting up in sequence. The newborn brain uses these intense physical jolts to take inventory. It is mapping its own internal circuitry and learning where its muscles are located. By feeling the diaphragm contract over and over again, the baby is learning how to eventually exercise voluntary control over their own breathing. They aren't glitching. They are actively calibrating their biological software so they can survive entirely on their own outside the womb. Knowing the science doesn't make it any easier when your baby is trying to feed or sleep and keeps interrupting themselves. When hiccups strike during a meal, the best immediate step is to pause the feeding. Take a minute to gently pat or rub your baby's back to help release the trapped air causing the pressure. If that doesn't work, you can try offering a pacifier. The physical, rhythmic act of sucking naturally helps relax the tense diaphragm muscle. Many infants will happily suck on a pacifier and ride the hiccups out without shedding a single tear. For babies who get hiccups constantly, pediatricians recommend preventative pacing. Try feeding them in smaller amounts, going a bit slower, and keeping them strictly upright for 10 to 15 minutes after they finish eating. The goal of all these steps is just to relieve trapped air and keep the baby comfortable. You aren't trying to artificially shut down a reflex that they actually need. While standard hiccups are an essential developmental tool, parents do need to understand the medical boundaries of what is considered normal. This decision tree shows the checklist pediatricians use to determine when a hiccup crosses into a symptom. The first red flags are duration and intensity. If hiccups persist continuously for several hours or are accompanied with forceful vomiting, contact your doctor. You should also watch their body language. If the hiccups coincide with poor weight gain, or if your baby arches their back in pain during feeds, they might be dealing with gastroesophageal reflux disease, which warrants a clinical evaluation. Then there is cyanosis, indicated by gluish lips or active struggling and wheezing for breath. This is an immediate, severe medical emergency, requiring urgent care, not just a standard pediatrician visit. It is vital to remember that these red flags are exceedingly rare. For the vast majority of infants, newborn hiccups require 0 medical intervention whatsoever. Barring those rare exceptions, that tiny hic sound is just the noise of a healthy nervous system growing stronger. For more evidence-based newborn care, subscribe to the Parenting Manual.